Hi, my name is Paul Sinwa. Today I'm presenting about high blood pressure. So tell me some things you know about high blood pressure.
I don't know anything about high blood pressure.
You really don't?
Yes, I don't.
How about you?
Could you explain it?
Yeah, sure. So high blood pressure is a silent killer, and it's when there's a lot of resistance on the blood, on the arteries in your veins, and it makes your heart work harder to pump blood throughout the whole body. So it makes your heart work harder, and it's a silent killer. It can cause risks such as heart attacks, strokes. It can also cause congestive heart failure, which will lead to fluid accumulation in the heart and make it, just make it extremely swell. So it's very hard on the body. And it's important you get your blood pressure checked. When you go to the doctor, you make sure you get it checked every year. Normal ranges are between 120 to 80. High ranges are 140 to 90, and medium ranges are 121 to 139 and 81 over 89.
Can it be too low?
There's times where it's too low, and that's when, maybe you're experiencing bradycardia or when the body's starting to fail.
Is it very bad? Oh, it's very bad if your body's starting to fail. What is the other one you said?
Bradycardia is when you have a low pulse.
Okay.
But usually if you have a low blood pressure, there's some people that normally range in that level. So usually if you have high blood pressure, you want to make some dietary changes. You might want to follow the DASH diet, which consists of low sodium, low fat, and fiber. Increase your activity, exercise for 30 minutes, 3 times a day usually. Risk factors that we can't change as a society are our age, our gender, our family history, ethnicity, socioeconomic status. Risks we can change though are our diet, lack of exercise, stress, alcohol, tobacco use. If you have diabetes, type 2 is curable. High cholesterol, you can always use pharmaceuticals or exercise and diet. Socioeconomic status, many of those are fortunate to either rise above the threshold and make themselves better and be comfortable in life. So,
what are some symptoms? Like, how can you identify that you have high blood pressure without actually getting it checked?
Usually you would have to get it checked, but there's subtle symptoms. Maybe you might feel dizzy, but usually with high blood pressure, it's silent. You usually don't have symptoms. There's people walking around with high blood pressure, they don't even know that they have it. They're just out there walking around with blood pressures around 150 to 96, and they don't even know that they have it. But usually if it's very high, you might feel dizzy, shortness of breath usually, very subtle symptoms.
What about smoking? I smoke a carton a day. Do you think that would be bad for my blood pressure?
Yeah, man, you're at high risk. You're at high risk for high blood pressure, lung cancer. When you smoke, you're adding on an extra risk factor. And if you have a family history, which you can't change, that even increases it more. And you're a male, and males usually have high blood pressure.
Could high blood pressure stem from other things such as anger?
Yes, stress.
Anxiety?
A lot of stress, anxiety. Usually when we have a lot of things in our mind, our central nervous system, there's a neurotransmitter called adrenaline, and it goes through the blood vessels and it stimulates so more load in the heart.
I recently had my blood pressure checked, and it was 131
I like
over
the type, by the
90.
way. Very good. You look pretty healthy. You look like you work out. How much was it?
My blood pressure was, I think it was a 141 over 90. Am I at risk?
141 over 90. Yeah, you're at risk, man.
What steps should I take?
Well, it looks like you lift a lot, so you might want to go into cardiovascular exercises such as the treadmill, running, modify your diet. What do you usually eat?
Oh, I usually eat about a pound of bacon every morning. Then I usually have a ham sandwich and maybe some fried chicken for dinner.
Yeah, you might want to alternate your breakfast and lunch
American meal right
patterns.
there.
So what?
It's an American meal right there.
I know, but the American diet is what usually causes this, and our country is usually one of the highest in high blood pressure, cholesterol, and diabetes. So what you want to do is make healthier options, like there's oatmeal, egg whites, wheat bread for breakfast. For lunch you can do a salad, whole grain pasta, whole grain bread with turkey. For dinner you can do roasted chicken, grilled salmon. There's many options.
Thank you.
You're welcome, man.
So in a 5-step process, how can you knock out high blood pressure?
5-step process. You always want to go get checked once a year. It's very important.
Checked once.
Once a year, get checked. Know your family history. It's very important to know if your grandparents have it, great-grandparents, your mom and dad. It's very important.
Is there a certain age where you are more at risk? Because I know, like, when you're young, you can control stress, or you can. And so, is it 1 year older? Because I know, like, a lot of elderly people are much more prone to have high blood pressure. Is there, like, a risk factor, like, connected to age?
Usually because as we age, our heart has been working so hard and the arteries get narrow and stiff. So as they become narrow and stiff, it's harder for blood to pump through it. So usually with age, you'll tend to see higher high blood pressure. But even when our age now, we're still at risk. But higher risk for older, but they're still at risk in our age group.
Is there a breakdown of what ethnicities have it more, say like Cubans or Nigerians or Oklahomians?
Usually African Americans, followed by Hispanic. And then, Oklahoma is in the southern region of the United States, where the diet tends to be very harmful to the body, such as high fats, high sugars, high carbohydrates. Yes, the roadkill diet, as they say, just slap on anything and put a load of butter and lard. Yes, that could be very killing to the body. So, But lifestyle changes. Alternate ham bacon, turkey bacon. Alternate. Give me an example of your diet.
Chicken fried steak.
Chicken
fried chicken. Would that be good?
Chicken fried chicken. Maybe you can, instead of frying it, put it in the oven. Use olive oil. Use whole wheat breadcrumbs.
I see.
There's always a way.
What if you're on a tight budget and can't afford more expensive items, such as healthier items? Because when you look at the store, organic or healthy or range-free items tend to be a little bit more expensive. What would you say about doing that if you're on a tight budget?
That also comes a problem, whereas the socioeconomic that we can change or we can't change.
Mm-hmm.
So things we can do there. You stumbled me, man. It's a very good question, Heath. That's why we have those risks that we can't change in there. We would have to try very hard to look for, items that were very cheap, that were still healthy.
Shop at a salvage store, I could do that.
Where?
Salvage store.
Where's the salvage store?
Like where the old food goes.
No, you still want to eat fresh food because you don't want to get E. coli, salmonella. Don't tear your stomach up.
So I was working out the other day. My blood pressure, when I told you previously, was taken before. And then I worked out, my blood pressure was lower. Should I be concerned?
No, it's just physiological changes. Usually when you work out, that goes higher.
Usually.
Yeah, usually when you work out, it goes higher. Like right after you work out. Now, a steady process of cardiovascular workouts, maybe for a month or two, you'll see it drop.
As well as a carton a day smoker, I also drink a handlebar of vodka every day as well.
A handlebar, you sure?
Yes. And I was wondering, does that have
Are you an alcoholic?
People would say that, but I don't think I am. Well, does that have an effect on my blood pressure?
It does. It has an effect on your kidneys, your liver, your blood pressure. You might want to go to your doctor. You might want to register yourself in some programs.
Yeah, everyone's trying to tell me to go to rehab, but I won't go. No.
I mean, rehab is not. It's not to stigmatize you. It's to help you. It's to help you lead a better life. To lead a life free of tobacco, alcohol, things that are depriving you from leading a healthy life, free of,
I see there's salt on there too with my margaritas. I love the salty rims.
You have the alcohol, the margarita.
Guess all the fun's trying to be deprived. Be healthy.
There's always different ways to have fun. Always different recreational activities we can all participate in.
That's right.
I am an avid user of smokeless tobacco. Is that a safer alternative to smoking?
I haven't researched really much in smokeless tobacco. I gotta get back to you on that.
Back to high blood pressure. My grandfather, he suffers from high blood pressure, and I know one time he had a severe nosebleed.
Yes.
So can you tell me why that happened, and what are the true risks? I mean, can you what can that nosebleed lead to?
Usually I think the nosebleed, if I'm correct, usually the way for the body to release the pressure. So because my mom has had that before, and she has high blood pressure. And what that happens is the capillaries get so overloaded in the nasal area that it just begins to just bleed. So that's why people with high blood pressure, they have nosebleeds. They'll just cauterize the arteries here so that they won't start bleeding. Yeah. Any more questions?
I've had nosebleeds before. Does that mean I have high blood pressure?
It depends. Do you have high blood pressure?
I don't know. That's not. Is that a symptom? Like,
I mean, it's not a symptom, but it will happen if your blood pressure progresses for a long time. It's usually it's another side effect of your primary disease of high blood pressure. I mean, you're young though, but that alcohol, tobacco, all those combinations, and your bad diet. I mean,
I see the risk we can't change, but is rugged good looks on that risk?
rugged good looks.
Yeah. Could you get high blood pressure from rugged good looks?
I don't think that's a risk, my friend.
What are some options when you say, what are like to control stress?
Exercise. It releases endorphins. When you release endorphins in the body, makes you feel better about yourself. You release serotonin, which relieves depression. You feel great about yourself. Yoga, a very good relaxation method. Pilates, a very good relaxation method. The sauna is very good. You release the toxins. You could do stretching in the sauna, swimming, aerobics, just laughing with friends. Just regular day life stuff. Any other questions I can help you guys with?
I think I know how to knock out blood pressure now.
So what's a safe range for healthy blood pressure?
120 over 80.
Perfect. And what kind of things would you want to avoid in your case?
Go to rehab.
Go to rehab.
Stop drinking and smoking.
I think that'll be very good. You might want to talk to your doctor about that. How about you guys? What did you guys learn today?
I drastically need to change my diet.
Yeah.
I need to start incorporating cardiovascular training into my regiment.
You do. And you?
I realize there are some risks that I can change so I don't suffer from high blood pressure.
That's right.
I can work on my diet
Very
and
good.
exercise and control my stress.
Yes, very good, very good. Thank you guys very much. Appreciate you coming to watch my presentation. Hope you guys learned a lot. Thank you very much. And I hope everything works out for you, man.
It will.
All right, man. It's good. Thank you.